What is carpal tunnel syndrome? What are the signs and symptoms? And what can you do to overcome it? I'm Dr. David, orthopedic surgeon, sports medicine specialist, and author of That's Gotta Hurt: The Injuries That Changed Sports Forever. I provide education, information, and commentary on sports and exercise, injuries, injury treatments, and injury prevention for athletes and active people so that you can stay healthy and perform your best. Carpal tunnel syndrome is probably not that common in high-level athletes, the pro athletes, the college athletes, but it does affect a lot of adults that love to exercise. We hear about it a lot in people that type all the time and do office work, but it can affect a lot of people. People that do repetitive work with their hands, like carpenters and mechanics and those types of people. Yes, secretaries and people that do general office work and typing, computers, that kind of thing. People on the phone a lot definitely can help. But in theory, it can really affect all kinds of people. This is a problem where the median nerve in the wrist, if you turn your hand palm up, you have this nerve that runs in this area right between the big muscle masses at the base of your thumb and the base of your little finger. The median nerve runs in that area. That's called the carpal tunnel. And it can get pressure, because that carpal tunnel narrows for a variety of reasons. Or the nerve gets inflamed. Or there's lots of reasons that carpal tunnel can sort of constrict, and then that puts pressure on the nerve. Typically, the symptoms involve numbness, tingling, weakness of your thumb, your index, and your middle finger, maybe half of your ring finger, the side on the side of the thumb, and it's typically the palm side. Again, with the numbness, the tingling, the weakness, you may have some vague hand pain in the palm and in the fingers, difficulty with grip, things like that. Certain positions may aggravate you, like keeping your wrist bent or flexed for a long period of time. But again, those are typically the symptoms. Usually it's not after a traumatic event, comes on over time, over weeks and months. Now, very often you can get better without surgery, especially if you catch it early. Maybe anti-inflammatory medications, maybe a wrist splint that keeps your wrist from bending for long periods of time. Sometimes even a cortisone shot into that area can be reasonably helpful. But yeah, sometimes people just don't get better and you can have surgery. Sometimes your doctor or surgeon may get some nerve conduction studies to prove that that's what the diagnosis is. But the surgery is an outpatient procedure where they make a small incision over that carpal tunnel. You basically release the tissue, sort of the roof of the carpal tunnel, to allow those, basically the tendons and the nerve, to have room without having pressure on it. You close the skin, and that can do very well. It takes several weeks to sort of fully recover, but you can get back to things you want to do fairly quickly. And if that is kind of the issue you're dealing with, the symptoms, and that sounds like your issue, maybe talk to your doctor or to a hand surgeon and get that looked at, because it's a relatively straightforward thing to overcome. Have you suffered carpal tunnel syndrome, and how did you get over it? Did you have surgery, or what did your doctor do to help you get better? I'd love to hear your experience, and honestly, I think readers and viewers all around the world would love to understand what you went through as well. So below this video, describe your experience. Let us know how it went so we can basically learn from you. Now, I would love to know the biggest challenge you're dealing with your injury. In the description below this video, I've included a link that you can click on, and it basically gives you room to tell me all about not just the injury, but the specific difficulties you're dealing with, so I can better understand what it is you're dealing with and how I can best help you. So click that link in the description box below and tell me about your injury challenges. Last, I record several of these videos every single week, including doing live videos where I'll answer some questions as well. If you want to get notified about those new videos and the live videos, subscribe to my video channel. Click the subscribe button in the upper right corner of the page. I record, again, several videos every week about sports injuries and injury treatments and injury prevention, and you'll get notified right away. Thank you so much for watching. I hope this was helpful, and I look forward to seeing you right here next time.